Well, thanks for staying with us. October, of course, is meant to draw attention to breast cancer awareness. And one local hospital wants you to be aware that they have a new tool to battle the disease. Kimberly Iverster is the director of St. Luke's Cancer Care, and she joins us live this midday. And you're here to tell us more about IORT. What is that?
Yep, IORT stands for Intraoperative Radiation Therapy. So it is a way to deliver radiation therapy in combination with breast-conserving surgery in the OR at the time of the surgery. So lots of benefits to that in regards to the radiation being delivered precisely to the area that the tumor was taken out of. So you hit that tissue and kind of what we call the tumor bed. So hopefully you're killing off any cancer cells that are remaining there.
And you mentioned it happens during the actual surgery.
During the actual surgery.
Does that cut back on, future visit? Obviously, patients have to go through a lot of treatments, and that can be exhausting. And one of the things every patient probably wants is, can I come to the hospital fewer times?
Yes, exactly.
And so this would help with that?
Yep, so the goal of IORT, specifically with the research trial that we are doing it through, is to see if we can give a concentrated dose of radiation therapy during the surgery, which will then result in having fewer outpatient treatments for radiation after the surgery is given. So through the clinical trial that we're using, the concentrated dose given during the surgery, in addition to 3 weeks after surgery and after they've healed, versus what typically is given as 6 weeks now for an individual. So it's the same amount of radiation. The study is just really looking at, can we give it in a different time frame and kind of a different combination and still get the great survival rates that we have right now with breast cancer.
Interesting. Okay, so who would be a good candidate for something like this?
Candidates for this would be a newly diagnosed breast cancer patient, and on this trial that we're doing, it's for women that have smaller tumors, so what we would say as an early stage disease, and ultimately the woman cannot have lymph nodes involved, but a lot of times we don't know that till we get a little bit farther into her treatment. So for the most part, it's middle-aged women who have smaller breast cancers.
Okay, and people looking for more information, there's a website that they can visit?
Yep, there's a website that they can go to, the radiationduringsurgery.com, and they can also call the St. Luke's Breast and Bone area at the number on the screen as well to get more information.
Interesting. Hopefully this helps a lot of women. Obviously, Breast Cancer Awareness Month, a lot of women find out that they have breast cancer because they do that self-exam and take that next step this month. So, Kimberly Iverster, thanks so much for coming in today to tell us more about IORT. I'm going to go with the short version.
Sure.
That rolls off the tongue a little better than the full version. Thanks so much.
You're welcome.
Well, coming up tomorrow, we will